Good morning, everybody.
Good morning.
Thank you. My name is Ed Maybach. I am the director of the Center for Climate Change Communication here at George Mason University. It is my pleasure and my honor to welcome you all. I knew I was going to be excited this morning to see you and be with you, but I cannot tell you how much more excited I am than even I anticipated, because this is a moment that has been long in the coming. I'm also excited because I get to play the body double, essentially, of our president, Angel Cabrera, who we asked to come and greet you. He was unfortunately not able to, but he asked me to say the following things. Welcome to George Mason University, a home of conservative scholarship in America. Just to acknowledge what many of you might be on your mind, being here at George Mason University, we are absolutely known as one of the hotbeds of conservative scholarship in America, but also, and perhaps more germane to today, a home of cutting-edge climate science in America. Our climate dynamics team is one of the their model is one of the 20 models that is included in the IPCC global modeling exercise. So we are, yes, we have conservative scholars. Yes, we have climate scholars. We got everything in between. We are a university completely dedicated to the notion that the world has some big sustainability challenges, but our university plans to play and is playing an important role in trying to help figure out a path forward. So it is in that spirit that I welcome all of you. The conversation that we're going to have today and tomorrow is a really important part of that vision. There, as a public health professional, first, foremost, and always, a public health professional who has been working for the past 11 years exclusively on climate change as a public health issue, this is the most important conversation going on in this town today and in any town today. So you are in the right place at the right time. And now allow me to introduce you to the right person to coordinate that conversation. About 5 years ago, this incredible person, Dr. Mona Sarfati, called me up and she said, I knew Mona, I knew what an incredible scholar, a woman who has had a glorious career in family medicine, in health policy, in public health. She called me up and said, Ed, I would like to come work with you at the Center for Climate Change Communication because I have this deep sense that my medical colleagues and I need to be playing a role in helping America deal with its climate challenge. From that first conversation on, she had a very clear vision for what had to happen. And I have spoken to a number of you already this morning who have commented that this today is so exciting because this is so clearly a manifestation of what Mona has been talking about and has been working towards and planning for the past 5 years. So it is my honor, my privilege to introduce to you my colleague, Mona Sarfati.
Okay, thank you, Ed, for that introduction, and welcome to everybody who is here. People have come from across the country, from California and Minnesota and Michigan and Florida and Colorado, and are just delighted to see you all here this morning. This is the Climate Health Solutions Conference that's been put together by the Medical Society Consortium on Climate and Health. And we are an alliance of medical societies that organizes, empowers, and amplifies the voices of America's physicians and other health professionals to convey how climate change is harming our health and how climate solutions can improve it. The consortium is growing rapidly. A year ago, at the time of our launch, we had 12 societies representing 400,000 members, and today there are 21 society members representing over 550,000 physicians. We collaborate with many allies in this important work, and some of you here today are from those allied organizations. What we know about climate and health is that climate change is harming the health of Americans today, and will harm more tomorrow. But most Americans are not aware of that important information. Research from our center, headed by Ed, shows that when people learn this important information, they begin to become more interested in the issue, and they see value in the information. It helps them understand that climate change is about them, not about polar bears, glaciers, and penguins, but about them, about humans. Our challenge and our opportunity is to make sure that the rest of America knows what we as health professionals know. A rapidly growing number of us are taking action to get this information out there by making presentations, by visiting policymakers, by doing media activities. And in fact, at this point, we have on our website alone over 400 advocates who have registered and are reporting in their activities. There have been 287 activities reported, and we know that the real number is many times that, because many have not logged in their activities. We encourage you to do so. It's really easy. It's on our website on the landing page, and we're keeping track of that, and we're providing that information to others so that they understand just how many physicians and other health professionals are sharing what they know with the American public. We've received a substantial amount of attention during this last year since our launch because of these activities, with hundreds of newspaper articles, blogs, posted videos on the internet. This story has legs. It's been astonishing to our public relations firm, and it will continue to have legs if we tell the stories that we know, of the people that we see every day. The most important solution to climate change is switching to clean energy that doesn't produce carbon pollution, and to increase energy use so that we can also reduce carbon pollution in that way. Doing this will give us cleaner air and cleaner water. It'll address also the degradation of the climate and protect people in the United States and around the world from the serious health risks of climate change. Those of us here today are the start of something very important. Our trusted voices must be heard. They will be heard. We have to build on this momentum. The health of all Americans and all people around the world depend on it. I'd like to quote Michael Jordan, who ended his incredible basketball career here in D.C., playing for the Wizards. And he said, "Some people want it to happen, some wish it would happen, but others make it happen." And I am confident that our voices will be heard because you here today are already making it happen. Our members, our affiliates, our steering committee, our supporters, and all of the talented staff that we have that have brought us together today deserve recognition. And I'd like, if they're in the room, to ask them to stand and get a round of applause from all of us here today for all the hard work that they did to bring us together. So please stand if you're in the room. I think that they're still outside registering people. So if you see them, please thank them because they've done just a really astonishingly fantastic job of planning this event. A major thank you goes to our generous organizational supporters and sponsors, George Mason University, the Kresge Foundation, Johnson & Johnson, the Energy Foundation, and Kaiser Permanente by way of healthcare without harm. Thank you, thank you, thank you. Without your support, this meeting and our work would not be possible. Over the next 2 days, you will hear updates and reports about what is going on around the country to inform our colleagues, the public, and policymakers. Please take the opportunity to network while you are here. Good communications and good networking are critical to what we need to do to achieve our goals. On Tuesday afternoon, many of you will visit Capitol Hill to inform our policymakers and urge them to embrace solutions. This is done in collaboration with the American Lung Association, and I want to acknowledge their support and their help. in getting these visits to Capitol Hill planned. And we have 5 outstanding medical leaders who are here now and who will each give a very brief welcome. So first I'd like to introduce Dr. Nitin Damle, who is the immediate past president of the American College of Physicians.
Well, thank you, Mona. It's really a real pleasure and an honor to be here. ACP in 2015, actually, the American College of Physicians is a 155,000 member organization of internal medicine specialists and subspecialists around the country and around the world. We actually have 19 international chapters. And in 2015, we recognized the importance of the health effects of global climate change, and we put together a policy paper at that time, and Ryan Crowley, who's here, it was a staff at ACP, really engineered a lot of that policy work and that research around it. And once we published that paper, it allowed us to go forward and really start talking about the health effects of climate change. In 2016, Mona put together this, along with other folks, put together this consortium. And we were one of the founding members of this consortium. We were happy to be a founding member because we recognize the importance of this work. Consortiums are really important. We did that recently, and I was down in D.C. a lot talking about the Affordable Care Act and the repeal of the Affordable Care Act. And what we found was that when we worked with other organizations, and we had 6 organizations together, including AAFP, to talk about why repeal of the ACA would be a bad idea, and we actually were, I thought, fairly successful in making sure that that did not happen. So the whole concept of consortium, I think, is very important, and I think this is a critical group going forward. So along with a lot of other things that I've been doing, I've been talking about climate change and health 35 times now over the past 2 years. I've given talks all over the country and all over the world, I split it up into what climate change is, what the health effects are, and then what mitigation efforts that we can launch in order to prevent some of the dire health consequences of climate change. And really the most pushback I got was in the United States. People in Europe, people in the Middle East, people in Latin America really are more bought in. In the Far East, when I spoke in Indonesia and Japan and in China, they were much more bought into the idea that things need to change, and they were recognizing the health effects. And so we need to be leaders, not just in the United States, but in the world, moving forward with this issue. And I think we can do that with efforts like this. But it really comes from 2 things. One, you need champions. And so all of you, I think, are champions. I think you need to be champions of this topic, and you need to go out there and spread the word about climate change and health. And then you need grassroots efforts. So you need to really invigorate the folks that you're talking to in the audience to take action. And we need to take action now, not in some distant future, but now. And I think that's really a message that we need to spread. And this type of organization, we had a steering committee meeting last night, and it was clear that our opportunities and our strengths far outweigh our threats and our weaknesses. And that's where I think we can move forward. And this is a wonderful opportunity to do that. So I urge all of you to take this time now to really, when you leave here, think about one thing that you can do that's going to make a difference as far as grassroots are concerned. So with that, I'm going to introduce Julia Wood, who is the Vice President for the American Academy of Family Practice. Thank you.
Good morning. Thank you, Nitin. It's an honor to be here on behalf of the nation's 129,000 family physicians. Our organization is taking climate change and health very seriously. Our members are asking for information and education. One area we are particularly interested in focusing on and assisting the consortium with is around the areas of health equity. That's been a large focus for us in the AFP and will be continuing to go forward. And as many of you know or will learn over the next few days, health equity and the disparities related to climate change and health are significant. So we find this really important for us because we take care of all ages, genders, the family, many people from a biopsychosocial model. So as we continue to do that and look at social determinants of health, what we learn here today and champion together will be very important moving forward to improve them and protect the health of our nation. Thank you. And I get to introduce Doris Brown, who's the president of the National Medical Association.
Good morning. Well, I'm here to bring you greetings on behalf of the National Medical Association, an organization that's nearly 125 years old, primarily representing nearly 30,000 African American healthcare providers, primarily physicians and allied health professions. We have actively been engaged in clean air and clean water and climate change issues for many, many years. As many of you probably know, that when you start to talk about the health consequences of contaminated water and pollution, of course, the impact on the African American population is disproportionately higher in our population, particularly in our children as we grow up, certainly with asthma and lead poisoning and neurological issues. All of those impact our population in a significant way. And we have certainly been one of the founding members of the consortia. We have been working with climate change, and I should say thanks to Dr. Mark Mitchell, who is chairing the committee. He has actively had us engaged, and we have been on Capitol Hill. We are talking with our legislators, both at state and local areas, and are really, really working to see that we can bring about health equity in the area of environmental justice. And I would like to then now introduce Dr. Jerome Paulson, who is president of the, maybe not president, but representing the American Academy of Pediatrics.
Hi, I'm Jerry Paulson. I'm the medical director of the Climate Change Initiative for the American Academy of Pediatrics. I might have aspirations to be president, but thank you. Please take a deep cleansing breath. How often do we hear people say that? Many of us incorporate some breathing technique into our daily lives and or teach breathing exercises as part of mindfulness training for the learners whom we train. How ironic that while what we breathe today contains many fewer air toxics than 40 years ago, there is an excess of CO2 and other anthropogenic greenhouse gases. The American Academy of Pediatrics is very proud to have been the first medical society, specialty society, to publish our concerns about climate change in 2007. We were very happy to see many other medical societies publish similar documents around the time that we published our updated materials in 2015, led by Samantha Adut. The Academy is very proud to have been a founder of the Medical Society Consortium on Climate and Health, and we welcome you all here today. We look forward to working with you over the next several days and into the future as we advocate to reduce CO2 and other anthropogenic greenhouse gases. For the health of all Americans and all the people in the world, healthcare providers need to convince our colleagues, our patients, and our representatives that a decarbonized world is the only survivable world. The American Academy of Pediatrics welcomes you all to the challenge and to the process. And following me is Dr. Nadine Nicola, an obstetrician gynecologist and a leader for their environmental health work.
Good morning. It is a pleasure to join Jerry Paulson and the American Academy of Pediatrics, as well as the organizations I represent, the American College of Obstetricians and Gynecologists, in welcoming you all here today to this conference. It's quite natural that Jerry and I have been on some of the same positions together, that the OBGYNs and pediatricians have worked together on this issue. And there's a Native American proverb that says, "We do not inherit the world from our ancestors, we borrow it from our children." The issue of climate change is of particular concern to OBGYNs. Women face some of the greatest risks from climate change over the course of their lives, especially during pregnancy and that critical window of fetal development. In affected areas, climate change can put pregnancy at risk for preterm delivery and low birth weight babies, and it puts all women at risk for disease, malnutrition, poor mental health, lack of reproductive control, and even death. Additionally, women's exposures to these toxic environmental exposures during the preconception and prenatal stages can have a profound effect on obstetrical and later life outcomes, including increased risk for birth defects, neurodevelopmental delay in children, and childhood cancer. Unfortunately, every day we find new evidence of how climate change is affecting obstetric and GYN outcomes and dramatically impacting women's health. And it is with this evidence support us that we're able to speak authoritatively to our patients about these risks. So we are very pleased to have you all here today, and we look forward to learning with you and from you over the next 2 days. Thank you.
And now I would like to share with you a brief video.
We all have heard the statements and the statistics. Climate change We all have heard the statements and the statistics. Climate change is the biggest global health threat of the 21st century and is likely to cause about 250,000 additional deaths per year by the 2030s. Combustion of fossil fuels, which drives climate change, also causes degradation of air quality, and ambient air pollution causes 4.1 million premature deaths around the globe each year. These statistics are compelling, but the images that we typically see associated with climate change and air pollution in the media usually are from distant lands like the Arctic or northern China. But we are seeing signs that climate and other environmental changes are impacting the communities we live in and people we know right now. So we asked medical professionals if they are seeing the impacts of climate and environmental change on their patients.
Hi, I'm Dr. Cheryl Holder, and I'm from Miami, Florida.
I'm Matt Burke. I'm a family physician from Arlington, Virginia.
I'm Dr. Ernest W. Kinchin, Jr. I'm from Lafayette, Louisiana. I'm actually a general surgeon who's always done primary care.
I'm Kimberly Kleckner. I'm a family physician in Omak, Washington.
Larry Clyde Daniels. I am from Shreveport, Louisiana.
And what is your specialty of medicine?
Family practice.
This is what they had to say.
I have experienced the effects of climate change in my practice. I can tell you, at least from our standpoint in urgent care, we're seeing lots of folks with allergies.
We're talking sunburn, we're talking sun poisoning, then we're talking rain every day. We're talking mosquitoes, mosquito bites, increased incidence of West Nile.
Increased rates of these pulmonary diseases.
Some people have been affected by the mold and coughing and and their asthma and chronic obstructive lung disease has been affected through being exposed to mold and damp conditions.
Massive hurricanes, extreme wildfires, and excessive heat. But we know climate change is affecting more than just the weather. It is affecting health across the country in a way that physicians are seeing in their offices.
I think we just have to open our eyes and recognize, first of all, that climate change is a real health concern.
Every year I see allergies getting worse, and people who used to have just spring allergies are now having summer, spring, fall, winter.
Lots of folks with allergies. They're coming sooner and lasting longer, and people are actually quite confused and concerned about their symptoms because they feel tremendously sick.
It's affecting real people's lives, and we have to do a better job of addressing that and making better decisions.
We have a responsibility that goes beyond writing prescriptions and managing patients in hospital beds.
Climate change is real. Climate change is affecting us on a daily basis, and I would love for that information to get out to everyone and for everyone to share that information, not only with their family, with their friends, with our legislators. It's just very important that everyone know the personal impact of climate change.
While working to counter the effects of climate change may feel like a daunting task, doctors are rallying around the idea that we can improve health of patients by working to improve the health of the planet. Join us as we raise awareness of the real health impacts of climate and environment. Ultimately improve the lives of patients and fellow citizens.
Okay, I'd like to thank our Medical Society leaders for welcoming us. And now I'd like to introduce Dr. Samantha Adut, who will introduce the Virginia Cabinet Secretaries who will welcome us to Virginia.
Glad we have name tags so I know where to sit, so thank you.
Good morning. My name is Dr. Samantha Adut, and as a pediatrician in Alexandria, Virginia, and chair of Virginia Clinicians for Climate Action, it is my great pleasure to introduce our next two distinguished speakers. We will first hear from Dr. Dan Carey. Dr. Carey joined Virginia Governor Ralph Northam's administration in January of this year as the Virginia Secretary of Health and Human Resources. Dr. Carey has been at the forefront of the medical leadership community in Virginia since 1997. He served as the Senior Vice President and Chief Medical Officer at Centra Medical Group. Dr. Carey has also served as President of the Lynchburg Academy of Medicine, the Medical Society of Virginia, and the Medical Society of Virginia Foundation. A long-term resident of Virginia, Dr. Carey graduated from the University of Virginia and Harvard Medical School. And I'll introduce now also our second speaker who will follow Dr. Carey, which will be Mr. Matthew Strickler. Mr. Strickler serves as the Secretary of Natural Resources for the Commonwealth of Virginia. Mr. Strickler served as legislative staff to the U.S. House of Representatives Committee on Natural Resources under Congressman Raul Grijalva. Prior to work in Congress, he served for 3 years as a legislative assistant to Dr. Ralph Northam during his term as a Virginia senator for the 6th District. He is a graduate of the Thomas Jefferson Program in Public Policy at William & Mary and the Virginia Institute of Marine Science. So please join me in welcoming first Dr. Dan Carey, followed by Mr. Matthew Strickler.
Well, good morning. Thank you for that introduction. How's everybody doing? Good, good. It's a real pleasure to be here with you all. I am not a content expert like many of you are. It is a real pleasure to meet with you all to better understand the problems of climate change. Thank you so much to George Mason University, to the Medical Society Consortium on Climate and Health, and all the speakers and attendees. We appreciate so much you coming to Virginia. Those of you who are here, great that you're here, and those who are visiting from outside of Virginia, thank you for coming to this meeting. A little bit about me, my background. I'm a clinician at heart. I'm a cardiologist. I've done that for over 30 years, and I spent the bulk of my professional life in Lynchburg, Virginia, taking care of patients and trying to understand how to prevent things as well as treat things. And in terms of the health effects of climate and climate change, I realize there's the acute effects of weather, disasters, and there's also the chronic effects of the quality of the air, the quality of the water, the heat, the access to a number of pathogens, and the like. But this came home to me, I believe in 2010 or 2011, when I was a head of the Heart Center in Lynchburg, and we had a weather phenomena called the derecho, which is it looks like a squall line on Doppler radar, but it's coming at you at 60 or 70 miles an hour with winds exceeding 100 miles an hour. And it hit particularly strong in my area of central Virginia, Lynchburg and Gretna in the central and south side of Virginia. And it was over, the weather event was over in about an hour or two. But with those winds, and it occurred in July, and with those winds, the power was out for 7 to 10 days. So if you have patients that have chronic respiratory problems, or they have congestive heart failure, or they have ischemic heart disease, or they have amputations and just getting around, if you want to expose them to stress, cut off power and have above 100-degree weather for 7 or 10 days in a row with no power, no air conditioning. Our health system at that time was truly overwhelmed. We had a triage center set up at one of the universities that had IVs, and it looked like wartime triage because folks had life-threatening illnesses, and we have the second busiest ED in Virginia and used to 300 and 400 people a day, but we were overwhelmed. And that's just one event at one point in time. And I realize that's only a small part of the picture, but given that weather disasters are increased over 40% since year 2000, whether it's hurricanes or tornadoes or heat stress or the effect of prolonged drying and drought, a drought leading to forest fires, these are occurring, as you well know, with increasing frequency. And it only takes one of these episodes to let you know just how thin the line is between taking care of the problems in the public health and being overwhelmed by those problems. So I understand, my main job is to understand and to listen and to learn and to be able to support in Virginia those programs and processes that better understand the problem, mobilize data, and connect with communities like those of you here today. So it was mentioned earlier that we are very aware that when you do have, whether it's air quality, water quality, problems that are precipitated by climate change, it always affects the most vulnerable communities, whether from a socioeconomic standpoint or those with chronic disease, the young, the elderly, and those with chronic disease, and those with marginal resources in terms of housing quality and the like. So that's very, very important to Governor Northam and to this administration. And one note, for those of you who don't know, Governor Northam, who's our governor in Virginia, he's a pediatric neurologist. He grew up on the Eastern Shore. He grew up on the water and is incredibly close to the environmental issues here in Virginia and nationally, as well as to the public health issues, and is very open and committed to these causes. What is the Commonwealth doing? The main avenue for us right now in the Secretariat of Health and Human Resources at the Virginia Department of Health of keeping data on weather-related stress, where are the hot spots of various conditions, and sharing that data with the community. The Virginia Department of Health was out front on communications of tick-borne illness, which are, of course, on the rise with ehrlichiosis and Lyme disease and the like, as well as with Zika, the Zika virus. So it's through that public health data that we can make better informed decisions, and continuing that effort and improving our analytics and improving our collections of data is incredibly important. And finally, we will continue to work with Secretary Strickler at the Department of Natural Resources, as well as the Virginia Department of Emergency Management when there is a acute weather disaster, to mobilize the necessary resources to deal with the water issues and the like. And lastly, I thank you all for your commitment to be here. Partly you're sharing the science. That's incredibly important to understand the science, that we're truly a data-driven public policy community, and that we inform the decision makers, whether in the administration here in Virginia or elected officials here in Virginia or in the nation. And I think it is incumbent upon us as healthcare professionals, as well as those in public policy, to better inform those that are making decisions, namely those that are passing laws and supporting programs like Secretary Strickler and myself and the governor, but also, importantly, the legislative body that if we want to pass cap and trade legislation or other greenhouse gas emission mitigation programs, we need the votes, and we also need great data and great advocacy from people who understand, like those in this room. So again, thank you very much for all you do, educating decision makers, educating your patients, educating the public about how important this issue is to all of us. And again, it's not just at the time of the derechos, it's all of the time. And this is a 24/7, 365 concern. And I appreciate you all keeping it on everyone's radar and increasing the communication and holding public officials, appointed officials like Secretary Strickler and I, accountable to make sure that we understand, making sure that we listen, and make sure that we're in a position to assist in all of these mitigation opportunities. So again, thank you very much for inviting me to share the welcome this morning, and I look forward for the rest of the morning to learning along with you. Thank you very much.
Good morning. Thank you all for having us here with you today, and special thanks to the Medical Society Consortium on Climate and Health, as well as George Mason University for hosting this important event. As you all know, the impacts of climate change on public health are real, they're serious, and we're seeing them today in Virginia, across the country, and around the world. New research on this topic is being published almost daily, and the more we learn, the less there is to like. In March, a study led by researchers at Duke University and published in the journal Nature Climate Change found that taking decisive action to limit carbon pollution could result in 150 million fewer premature deaths this century in the world's largest cities, including tens of thousands fewer deaths in the D.C. metro area. And just last week, the Natural Resources Defense Council, one of the sponsors of this event, released Virginia-specific issue briefs on climate change and health, showing that, among other things, heat wave-related deaths in the Virginia Beach area are projected to increase from an average of 20 per year over the last 35 years to as many as 170 by 2040 if we do nothing to address the climate change. This is in addition to what we already know about how higher temperatures lead to more vector-borne illnesses, higher sea levels that can contaminate drinking water, and intense storms that overwhelm sewer systems and make swimming in our rivers or the Chesapeake Bay a dangerous proposition. We have to act now to avoid the worst of these outcomes. Secretary Kerry and I are fortunate to work for a governor who understands this and has a unique perspective on the issue as a pediatrician from the heavily impacted Hampton Roads area. Governor Northam is committed to tackling climate change and has tasked us with working together to do that with an eye towards improving public health. That's why we're moving quickly to finalize a regulation that would cut carbon pollution from power plants in Virginia by 30% over the next 10 years and link Virginia to the Regional Greenhouse Gas Initiative carbon trading market. We're also developing a plan to use the $80 million in funds from the Volkswagen settlement to reduce pollution in the transportation sector, which is the Commonwealth's largest source of emissions. And we're exploring ways to decrease emissions from state government, like updating building codes, increasing energy efficiency, and buying more renewable power. I also have to mention the energy legislation the governor and his team worked on with the General Assembly to craft over the winter. This new law sets Virginia on a path to massive increases in renewable energy and energy efficiency over the next decade. In addition to working with other states and countries to reduce carbon pollution and address the underlying illness of climate change, we must also be proactive in treating the symptoms. That means taking steps to adapt to climate change and make our communities, our environment, and our critical infrastructure, including our public health infrastructure, more resilient. Governor Northam has named me his Chief Resilience Officer, for whatever that's worth. I think I'm happy about that. But I'm working across government agencies with the Department of Emergency Management, as Secretary Carey mentioned, with the Health Secretariat, and with a number of other of folks in state government to get working on this important task. The General Assembly has also recently passed legislation creating a senior advisor to the governor on coastal resilience. Hopefully, if that position gets funded, we'll be able to put that person to work quickly, which would be a huge help. All this important work is fantastic. We're glad to be doing it, but without your help, we won't be able to make the progress that we need to make. Legislators in the General Assembly will not take the additional actions we need to address public health challenges. So we're happy that you all are here. We're excited about the work you're doing, and we really need strong, clear, consistent communication from the people in this room and other healthcare and public health professionals in order to convince our elected officials to act. And of course, this can't be limited to state-level policy. We're making great progress in Virginia, but without renewed leadership from the United States, the world will fail to limit carbon pollution and global warming to safe levels. We all need to continue to press the Trump administration to stop pursuing reckless environmental policies and urge Congress to get off the sidelines and do what Trump refuses to do. And most importantly, we all need to vote and convince other people to vote for leaders who take climate change seriously. That's why I'm excited about this conference and about the opportunity to be here with you all this morning. I hope this dialogue doesn't end here, and it sounds like it's not going to, which is fantastic. And I hope all of you will engage in the difficult but important education and advocacy work we need to make real progress. Thank you again for your dedication and for allowing me to speak today. If it's appropriate, I'm happy to answer some questions as well. Thank you.
So we have time for a few questions. Would anyone like to ask a question of Secretary Carey or
a lot of promotion going on right here today.
Go ahead.
John Balthus with National Institute of Environmental Health Sciences. Two wonderful presentations. Thank you for your commitment and everything you're doing. I'm just curious, after the derecho, can you say anything, or in what you're doing now, can you say anything about what Virginia is doing about the resilience of its healthcare facilities and what it's doing to prevent that kind of long-term loss of power for the people who need it?
Well, that's a great question. I know in our health system, the health systems themselves actually had backup power that got going within. I mean, within 15 seconds they had backup power, and no ORs or no ventilators had a problem. I think the real issue is, do you have the depth when the actual number of people needing to be treated because of absence of air conditioning, absence of even water, became a real problem. So I think so the short answer is, in our community at that time, with the emergency management, they had more water trucks available, et cetera. But I'm not sure that we really have, I think, for lack of a better term, the resiliency and depth. I think your point is well is well made. I think the real question is, in such an emergency, when you go from 300 people a day needing to be treated to 1,000 people that needed to be treated, it's hard to build that kind of backup plan. So I think that, I'm not saying there's nothing we can do. We definitely need to work on our emergency management. Where are the triage areas? Where are the IV bags? Who are the emergency personnel? I know in our community we did learn some real lessons, but there's a definite need to have those plans with the Virginia Department of Emergency Management, others, to have those be able to be reconstituted or constituted rapidly. So the short answer is, I think there are lessons learned from that across Virginia. We do have emergency plans in place, but we probably need to drill even more than we do.
And if I could just add to that, it's an important question and something we do need to put some more thought and effort into. We're working on developing a statewide climate resilience program that will tackle that issue among the many others that we have. But we need to coordinate our health systems. We need to coordinate emergency management officials, public safety, and local governments, county governments, cities, in order to make sure that we do have all that stuff lined up when we have natural disasters.
Point. Thank you.
Yes. You can go ahead.
Hi, I'm David. And I know this is a complicated issue, but can you talk to us a little bit about building infrastructure for gas pipelines in Virginia and how you will approach the decision making on that?
Yes, thank you for the question. Wouldn't be a public speaking event unless I got a pipeline question, so always happy to field those. This is something that has been a real struggle for a lot of folks in Virginia, the governor, myself, and certainly the folks whose property may be impacted by the construction or proposed construction of natural gas pipelines in Virginia. And from the climate perspective, it is something that is a little bit difficult to wrap your head around when you're trying to make proactive decisions to reduce carbon pollution, and then you're looking at a situation where infrastructure to transport fracked natural gas from Pennsylvania and West Virginia through the Commonwealth is being considered, and will be built into our energy infrastructure for a long period of time if they go forward. The situation that we're in that's very difficult is that the Commonwealth doesn't have the permitting authority over whether or not these pipelines get built. That authority rests with the Federal Energy Regulatory Commission, which is an independent federal agency that looks at energy infrastructure projects, takes proposals, and gives the thumbs up or thumbs down about whether or not such proposals are in the public need. And whether or not they can get built, whether or not the companies are allowed to use eminent domain, for example, in constructing the projects. For the two projects proposed to go through Virginia, the Mountain Valley Pipeline and the Atlantic Coast Pipeline, FERC has given them both the thumbs up to proceed. And whether or not the governor agrees with that decision, there is nothing that the governor can do to change that. What the governor can do is look at Virginia's natural resources and see what the impacts of the pipelines will be on those natural resources, and seek compensation for damages, and also seek to hold companies accountable to Virginia's environmental laws. So what we've done on the compensation side is, for both pipeline projects, we have negotiated very significant compensatory mitigation agreements with the pipeline companies for the forest fragmentation impacts. There are a lot of areas of forest, both federally owned, state-owned, and private forest that these pipeline projects have proposed to cut across. We've negotiated, I think it's probably in the neighborhood of about $90 million of compensation to do good environmental projects, because of these foreseen damages simply from the forest fragmentation side of things. And then on the other side, our major hook is water quality and wetlands under the Clean Water Act and Virginia's state water control law. We have directed the Department of Environmental Quality to put in place a kind of never seen before in Virginia accountability program, both on putting in place stringent standards for ensuring that any construction that happens is protective of water quality, and then also on the back end with monitoring compliance and enforcement, holding companies accountable for building this infrastructure in a way that doesn't damage Virginia's water resources. So we're doing everything that we can on the state level to address this issue, but certainly from the climate change perspective, it's perhaps a puzzling decision by FERC at this juncture.
I think we have time for one more question. Yes,
I'm David Pollack, and I'm representing the American Psychiatric Association, American Association of Community Psychiatrists. And I'm encouraged to hear about the statewide resilience planning that you all are doing. One question is it well coordinated in terms of health as well as the other parts of state government? But the other question is, what are we doing in our health systems to reduce our carbon footprint in hospitals and academic health centers, the rest of the healthcare community, so we can, in effect, walk the talk that we do?
Well, the first part of your question is we hope so. Secretary Carey and I are going to work closely together on that, and we're kind of in the nascent stages of developing this initiative. But as we move forward, we'll certainly be coordinating.
And the second question, I'm not sure. When I visited health systems, they're touting their low water use and in terms of their high efficiency heating and air conditioning systems and the like, and recycling efforts. But I don't really know, and that's I think implied in that is, could we coordinate that better? And I hear you.
I will just add that there are several Healthcare Without Harm affiliated hospitals in Virginia. Nova Health System, for example, is part of the Healthcare Without Harm's Healthcare Climate Council, Bon Secours Health System. So there are health systems that who are actively pursuing reducing greenhouse gas emissions and working with Healthcare Without Harm. Okay. All right, thank you so much.
Thank you so much for your attention.
Good morning, everyone. My name is Cecilia Sorensen, and I'm an emergency medicine physician and a climate and health science policy fellow of NIEHS, University of Colorado, and the Medical Society Consortium. Thank you all for being here today. It's my great pleasure to introduce Dr. Mark Jacobson. Dr. Jacobson is the founder of the Solutions Project and the director of Atmospheric and Energy Program at Stanford University. He is also a senior fellow of the Woods Institute of the Environment and the Precourt Institute for Energy. He has received multiple awards, including the AGU Ascent Award for his work on black carbon climate impacts and the Global Green Policy Design Award for his work in developing state and country energy plans. In 2015, he was awarded a Cozzarelli Prize from the Proceedings of the National Academy of Sciences for his work on the grid integration of 100% wind, water, and solar energy systems. He has also served on an advisory committee to the U.S. Secretary of Energy. Please join me in welcoming Mark Jacobson.
Thank you very much for that kind introduction. So I'm going to talk about energy plans that we've been developing for cities and towns and states and countries to transition the energy infrastructure of all these places, and the whole world, in fact, to 100% clean renewable energy to try to eliminate health problems associated with air pollution, as well as address and eliminate climate problems and provide energy security. As you know, there are millions of people die each year from air pollution worldwide. It's estimated 4 to 7 million prematurely from cardiovascular disease, respiratory illness, complications from asthma resulting from fossil fuels and biofuel air pollution. And that's and 65,000 of those are in the United States, 13,000 in California alone. But every single state is affected significantly, and then there are hundreds of thousands of illnesses as well. And this costs the world, just based on statistical cost of life, $20 to $25 trillion per year. Global warming is expected to cost on the order of $25 to $30 trillion per year by 2050, due to all the impacts that some of which have been discussed, but there are many that I'm not going to take time to discuss right now. And then because fossil fuels are limited resources, they will run out over time, and their prices will rise over time. And as a result, because they're going to run out, we will have social, economic, and political instability over time, and we want to avoid that before it occurs. So these are three drastic problems that require drastic solutions. And so our solution to this is to try to electrify or provide direct heat for everything, where that electricity or direct heat comes from clean renewable energy, namely wind and water and solar power. So when I say everything, the major sources of energy, uses of energy worldwide are, well, there's electricity, there's transportation, heating and cooling, industry, agriculture, forestry, and fishing. These are the main sectors in which energy is used. I mean, electricity is only 20% of all the end-use energy worldwide. So we can't just focus only on electricity. We have to focus on all energy sectors. So our idea is to electrify all energy sectors. So transportation, we'd use primarily electric vehicles and some hydrogen fuel cell electric hybrids for long-distance trains, ships, and planes, for example. Heating and cooling, we'd use heat pumps for pretty much everything. They're much more efficient than even electric resistance heaters or gas heaters. And some solar hot water preheating. For industry, we'd use dielectric heating, arc furnaces, induction furnaces. And so these are all existing technologies. And then for the electricity, everything would be electrified pretty much, or we'd have some things where you have direct geothermal heat, for example. But we'd provide that electricity with just onshore and offshore wind power, solar photovoltaics on rooftops and in power plants, concentrated solar power, some geothermal power, existing hydroelectric power, and tiny amounts of tidal and wave. That would be for everything. I want to show you how we can do this. So just to give you some idea of the technologies and storage we would need, the hardest thing to transition, I would say, would be aircraft. I mean, cars we already have electric cars, and even trucks and tractors we have. But planes are starting to get going. So there are existing electric aircraft. I mean, you can see one on the left here is an electric aircraft. And it's expected that commercial electric aircraft will be able to go up to 1,500 kilometers for like a 50 to 100 seat plane, just pure electric. That's expected, and there are companies that are actually building these right now. On the bottom right is a hydrogen fuel cell aircraft that exists. It seats 4 people and can go 1,500 kilometers. What's going to be harder is these long distance commercial aircraft. And so on the top right is the drawing for one. Now hydrogen, it would be combination, well, our idea is a combination of hydrogen fuel cell and electric hybrids. It would require larger fuselages because hydrogen is not very dense, but it would have to be compressed into in low temperature to be cryogenic. But this is an existing technology. All the space shuttles and most rockets have been propelled into space on hydrogen. So it's not like it's a new technology, but it just hasn't been developed at the large scale so far. Anyway, so that would be the hardest, maybe by 2035, 2040 to transition. But in industry, we need to transition high temperature industrial processes, which currently require either coal or fuel oil to generate high temperatures, just burning them. We'd use electric devices that exist. A lot of industry already is electrified, but we'd use arc furnaces, for example, and induction furnaces, which you can see right here. And but then some new things that are going on that will really help this transition, especially for countries that have small land and have high populations, such as Singapore or Gibraltar, is offshore wind and solar, and that's floating offshore wind and floating offshore solar. But you can see these are existing technologies from these photographs here. We have floating offshore wind turbines now, and that's really going to open up the possibilities of a huge transition, because the greatest untapped resource in the world of clean renewable energy is offshore wind, and particularly off the east coast of the U.S. I mean, you can power pretty much the entire United States electric power supply with offshore wind off the East Coast, and not even use, only use a portion of the total area. But the fact that you now have floating offshore turbines means you can go further and further out without people complaining about the views and things like that, and the transmission's still not that far. So this really opens up the possibilities for this large-scale transition, and Virginia has huge offshore wind resources, as you probably already know. And so, but we'll need storage as well, and so we'll need storage because the wind doesn't always blow, the sun doesn't always shine, and people complain about, they're worried about the lights going out if we have too much wind or solar on the grid. Although, as we've seen increased penetrations of wind and solar on the grids in many places, we haven't seen grid problems. And because the grid operators, they figure things out as they're going along. And I mean, last year, Iowa had 37% of all its electric power generated from wind, and in some weeks it was like 67 to 70%. But the grid stayed stable. That's because grid operators figure out how to keep things stable. But with 100% clean renewable energy, we do need some kinds of storage. But there are many existing storage technologies. And the problem becomes easier when you electrify all energy sectors. Because right now, when we have a lot of loads which we call inflexible loads, such as the lights. When I turn the lights on, that could be at any random time. And so we need electricity right at that moment. But when you are driving an electric car, you're not plugging your car into the grid. You have batteries in your car already. So that's called a flexible load. A car is a flexible load because you can charge your car at night, and the grid operator can actually control when you get your electricity during the night if you have an agreement with them where you get a beneficial rate. In fact, I have 2 electric cars, and the rate for charging the car, it's between 11 p.m. and 7 a.m., is much lower than the rate of electricity at any other time of the day. So that's an incentive they've given me to just plug my car in between 11 and 7 a.m., and I do that. And so as a result, I hardly pay anything for driving. I mean, the fuel cost is very small. So this is called demand response. And so there are a lot more flexible loads when you actually electrify everything. So you're heating, for example, water heating. I mean, you're storing heat in the water. Well, I'm going to show you some examples in a second. But anyway, so for electricity, the types of storage that we will need, though, is some concentrated solar power, which has storage associated with it, pumped hydroelectric power, where you have 2 reservoirs, a lower and an upper one. And when you have excess electricity, you pump water up a hill. When you need the electricity, you let the water drain down the hill and run a turbine. And then existing hydroelectric dams are basically big batteries, and then batteries themselves. Those are electric storage. Heating, cooling, water, ice, and rocks, I'll show you examples in a second. And then hydrogen is a form of storage as well. And then demand response also helps keep the grid stable. So let me give you some examples. So ice storage. My university, Stanford, since 1998, well, till 2 years ago, had a big ice cube under a building. And what it would do is at night, when electricity prices were low, it would freeze the ice. And then during the day, instead of running air conditioning, which would use electricity at peak times of the day, I would run water through the coils in the ice and cool the water. The water would be sent to buildings and cool the building. So this was like a battery. This ice cube is like a battery. It avoids the use of electricity at peak times of the day, but it costs 1/10 that of a battery. Batteries are, well, now they're down to $200 a kilowatt hour of storage, but this is down around $30 a kilowatt hour of storage. So it's much cheaper, but it does the same thing. Then here's another example of seasonal heat storage. This is a town in Okotoks, Canada. It's 1 hour south of Calgary. There were 52 homes. They were built between 2004 and 2005. On the roofs of the garages on the top left, you can see these solar collectors. These collectors have a glycol solution in them, and during the long summer days in Calgary, near Calgary, you heat this fluid. The fluid then gets transferred by pipes to this building on the right, where the heat gets transferred by pipes to water in pipes. The water then gets piped under this grassy field, which is a play field that kids play on, that had been excavated and filled with rocks. And then the pipes just pass by the rocks, heat the rocks. The rocks get heated up to 80 degrees Celsius in the summertime, and that heat gets stored until winter. when the snow is on the ground, like on the left, and the whole system is run in reverse, and this provides 100% of the heating for those 52 homes. And while I said batteries are around $200 a kilowatt hour now, this is less than $1 a kilowatt hour of storage. So this is an existing technology that avoids the use of electricity for heating into wintertime, and it's called seasonal heat storage, but it's an existing technology. Well, you could do things a lot on your own, in your own home. I mean, transition is not just a government thing, it's an individual thing as well. And so I'm going to show you examples. I built a new home this last year, been there about a year now. There's no gas going on the property, it's all electric. And in fact, I'm sending about 25% of all my electricity back to the grid. So I'm self-generating, but I'm also sending 25% back to the grid. And the grid operators now, they have these new community choice utilities that will pay for the excess electricity at the actual time of use, which is kind of nice now because they're paying up to 25 cents a kilowatt hour for extra electricity. And this allows a payback. Not only do I no longer have any more gas bill or electric bill or gasoline bill because the cars are electric, but I'm actually getting paid for the electricity. And so this is quite a deal. I don't understand why everybody else isn't doing it. I mean, there is an upfront cost, but it does pay itself off now after about 5 to 7 years, and then everything is free after that for the next 30 years because that's how long everything's warranted. So this is just do it. I mean, if you have a chance, if you're either retrofitting your house or building a new house, no gas, just make it electric. Everything is so efficient. It's just the house is at a perfect temperature all year, and it's sealed, and I don't know. I haven't found a single flaw in this whole system yet. So these technologies have advanced so quickly that it's unbelievable. So let me just show you what this is. So on the left here is an air source heat pump water heater. It runs on electricity. The water heater, this is everything. It's in a mechanical room. It extracts heat out of the air from the room itself. So it actually cools the room slightly, but not that much. And so in the summer, that's great because I just open the door and it's excess cooling for the house because the air just flows into the house. And so it runs on electricity and it just heats the water just like a normal water heater. It's 80-gallon water heater. On the right are air source heat pump, air conditioner, and heater. And what's really called a ductless mini split air source heat pump, air heater and air conditioner. What it does is this one extracts heat from the air outside. Now, in a place where you get a lot of snow on the ground, you might extract the heat from the ground itself. So that would be a ground source heat pump. And there's now a company, for example, in New York called Dandelion, which instead of having to excavate your whole backyard and put coils under the ground for ground source heat pumps like they used to do for ground source heat pumps, is they drill vertically about 30 meters, a very small hole vertically, and they extract the heat out of the soil. And it's really efficient. It costs the same as just any other heating system. But there are just several of these units around the house, maybe one in each room. And they're pretty, they're silent, and they just create heat, and they create air conditioning. And they work very efficiently because they use actually 1/4 the energy of a gas heater or an electric resistance heater or an air conditioner because they don't create heat or they don't create cold. What they do is move it. And so because of that, they're actually using 1/4 the energy. So my energy bill, the energy use is so much lower now that I have heat pumps rather than either a gas heater or electric resistance heater. So this is the stove. It's an induction cooktop stove, existing technology, very efficient, but it boils water in 7 to 10 seconds. That's why people didn't like the electric resistance stoves before, because it took a while to heat water or boil things. And you can then touch the top when it's boiling the water, and you don't feel it because it's induction and it works on magnets. You have to have certain pots, but the pots are pretty inexpensive. You can get like 12 of them for $300. Okay, so then there's the electricity is generated by solar on the rooftops, and the electricity is stored in batteries. So this is nice because it shifts the time because I can then, instead of when the sun goes down, the first thing that happens is the batteries turn on to generate electricity when the utility is still charging the peak time. They're charging up to 45 cents a kilowatt hour in the summer in the afternoons through up till like either up to 9 p.m. And so then I can run through 9 p.m. with the batteries even if the sun goes down. And this allows you to save a lot of money as well. And then there are electric cars coupled to the batteries. But let me just show you briefly a week of electricity use just to show you how much you're generating compared to using in this entire home. So the green is the electricity generation from the solar photovoltaics. The light blue is the consumption of electricity during the day by the solar power, and then the dark blue is the consumption of electricity by the batteries, and they turn on immediately after the sun goes down. The red is grid consumption, and the only time you really have grid consumption is when I'm charging the cars. One of them charges up to 20 kilowatts, and the other charges up to 10 kilowatts. There's two spikes. And there's also, one time at night, but otherwise the batteries are basically providing electricity, allowing the provision of electricity 24 hours a day from the solar, because the bottom shows the charging, shows the batteries, it goes from 0 to 100%, so at the top it's when they're fully charged, and then it goes down to 50%. The reason it goes only down to 50%, not down to 0, is because my utility only allowed me to turn 2 of the 4 batteries on. And so I'm only running 2 batteries with this, and the other 2 are just sitting idle. But during the night, the battery discharges down to 50%, and then as soon as the sun comes up in the morning, the first thing is that happens is the batteries get charged by the solar photovoltaics. They get recharged, and then they sit around until nighttime, and they're used. So they're used every day, or every night they're used, and every morning they're recharged. But this whole system works extremely well so far. I haven't had any hiccups, and as I mentioned, I'm generating 25% more electricity over the year than I'm using. Okay, so let's look then, can we actually transition the entire world to just clean and renewable energy with these technologies? So we did roadmaps for 139 countries out of around 200 in the world, and these represent more than 99% of all the emissions. We only looked at the countries we had data for. We didn't have data for all the other countries, but they represent less than 1% of the energy and emissions. So just to give you some bulk numbers for all these 139 countries, their end-use power demand in 2012 was 12.1 trillion watts, or terawatts, and that's expected to grow to 20.6 terawatts by 2050. But if we electrify everything and provide that electricity with just wind and water and solar, we see an interesting thing. The power demand, without any heat pumps, it goes down to 11.8 terawatts. If we use heat pumps, it'll go down some more to about 8.6 terawatts. So that's 58% reduction of power just by going to clean renewable energy. And how does that break down? And this is not changing your habits at all. This is just transitioning. Because, we get 23 percentage points of that, 58% is due to the efficiency of electricity over combustion. And so, for example, you get most of this in the transportation sector. An electric car, 80 to 86% of the electricity in the car goes to move the car, and the rest is waste heat. Whereas in a gasoline or diesel car, around 17 to 20% of the energy in the gasoline actually goes to move the car, and the rest is waste heat. So if you go to an electric car, you reduce your power demand by a factor of 3 to 4. And so that's where you get most of your benefit in transitioning, is by going to electric cars. And in other sectors, it's a much smaller reduction of demand. And so averaged over all these sectors, it's 23% reduction of power demand just by electrification, the efficiency of electricity over combustion. Then there's another 13% reduction of demand because we eliminate all the energy in the mining, transporting, and refining of fossil fuels. That's 13% of all energy worldwide is just to dig for fuels and then transport them and refine them. Where solar and wind, the wind and solar coming right to the panel, right to the turbine, so we don't need that energy to go find the energy. So then another 16% is due to the efficiency of heat pumps This is averaged over all sectors again, because, well, if you replace one gas heater with a heat pump heater, there's a 75% reduction of demand just for that, because remember, a gas heater, well, a heat pump takes 1/4 the energy of a gas heater. But when you average over all sectors of all types of energy, then it's a 16% across all sectors. And that's not only for heating, but also for cooling and air conditioning and refrigeration. And then we can get another 7% efficiency reduction just due to end-use energy efficiency improvements and reducing energy use beyond what's expected in what's called the business as usual case. So the total is 58% reduction of demand just by going to clean renewable energy. So this is one mix summed over all 139 countries of the number of devices we would need to power effectively the world with 100% clean renewable energy. So it's like 1.6 million onshore wind turbines, about 1 million offshore wind turbines, and et cetera on the right. On the left is the percentage of each of these: 23.5% onshore wind, 14% offshore wind, 16% residential rooftop solar, 12% commercial government rooftop solar, 20% solar PV power plants, 10% concentrated solar power, 1% geothermal, 4% hydro, all of which exist, which is 0 on the right. These are a number of new devices. And then tiny amounts of tidal and wave power. So the land area that would be needed for all this is not that large. It's on the order of 1.15% of world land area. Most of it's onshore. So for onshore, we don't need any new land for rooftop PV. That just goes on rooftops. And hardly anything for geothermal, nothing for new hydro, because we're not adding any. It's only for onshore wind and utility photovoltaics plus concentrated solar. So the onshore wind, we would need about 0.92% of the world's land for mostly for space between the wind turbines, which could be used for agriculture, open space, or rangeland or farmland. And then about 0.22% of the land for photovoltaics in power plants and concentrated solar power. And those sum up to 1.15% of the land. But to put that in perspective, the oil and gas industry, just to take the U.S. for example, oil and gas in the U.S. alone is between 1 to 2% of the U.S. land area already. And that's because we have 1.7 million active oil and gas wells and 2.3 million inactive wells, and the roads, the well pads, the storage facilities, just for those wells, and the inactive and active ones take 1 to 2% of the U.S. land area. That doesn't account for the pipelines. That does not account for refineries or gas stations, or the rest of or even coal mines. So we're going to reduce the land use significantly by going to clean renewable energy. And because every year in the U.S. there are 20,000 new gas wells drilled for fracking, 20,000 a year, and you have to do this forever if you want to keep, and you have to dig new ones every year around and just pockmark the U.S. with oil and gas wells if you want to keep this oil and gas infrastructure going. So whereas if you go to clean renewable energy infrastructure, you basically, since it's renewable, you're not digging new wells. You'll have to add some turbines and some panels every year because of the growing population, but we don't have to replenish. It's not like you need to find new oil and gas like you do each year, because the wind keeps coming to the same places. The sun keeps coming to the same places each year. So what about keeping the grid stable? We did studies for all 139 countries. We broke the world into 20 world regions, or this 139 countries into 20 world regions, and did the grid stability analysis for each region. And this is for the U.S. plus Canada, the most of North America region. And we checked, can we match? Well, so my main work is building air pollution and climate models, and I've been doing this for the last 28 years or so. And so into this climate model that I built, we took all the energy, the number of wind devices and solar panels and concentrated solar plants for each country, and put them in the model in each country, and actually did it every 30 seconds for 5 years, calculated the wind power generation and the solar power generation, and used that time series for each country for 5 years, every 30 seconds, and compared it with power demand that we estimated for 2050 in each country every 30 seconds, and accounted for the storage options that I listed before to see is it possible to keep the grid stable in each of these 20 world regions every 30 seconds for 5 years. And so in this is for North America, this is 1 month, and this just shows results every hour. The red is energy supply, and the blue is demand plus changes in storage plus losses plus shedding of energy. And it shows that you can match power supply with demand exactly for this month. But it turned out we actually could do it every 30 seconds for 5 years in all 20 world regions. We keep the grid stable. So the result was, yes, we could do that. We could keep the grid stable. Here was the overall cost of energy. Well, first on the top is the conventional fuel cost of energy in just the electric power sector, because there's not a real easy way to calculate the overall cost of energy per kilowatt hour over all energy sectors with conventional fuels. So we just looked at the electric power sector for the cost here. It's 9.8 cents a kilowatt hour is the anticipated cost of energy from the fossil fuels in 2050. But there's another 12.7 cents a kilowatt hour in the health costs, and another 16 cents a kilowatt hour in the climate costs. So 38 cents a kilowatt hour is the social cost of fossil fuels in 2050. And right now it's a little bit lower but the health costs are pretty much the same now as then, as in 2050, for 13 cents a kilowatt hour. So that's the social cost is the direct energy cost plus the health cost plus the climate cost. So 38 cents a kilowatt hour is the conventional fuel electricity costs. Now that compares with our cost of energy worldwide in 2050 from wind, water, solar is 9.7 cents a kilowatt hour. So it's almost the same as the fossil fuel direct cost, but we eliminate the health and climate costs that in the electric power sector. In all energy sectors, wind, water, solar was about 10.6 cents a kilowatt hour for accounting for transportation, heating, cooling, and industry. We don't have a comparable cost for fossil fuels for that, but that's why we did compare the electric power costs. So anyway, okay, so let's say the direct cost is similar for energy, but the social cost is 1/4 for wind, water, solar. But on top of that, this is the cost per unit energy. But remember, we need 58% less energy in wind, water, solar case. So 42 to 58% fewer kilowatt hours. So really our total cost is 1/8 for clean renewable energy. It's 1/8 the cost of fossil fuels if you account for the social cost. And to the consumer, consumers will pay 1/8 if you average over worldwide, and accounting for the social cost. Anyway, so we think it's beneficial. Now the next question is, do people want to do this, or where are we at? So there are some recent public opinion surveys on whether people want to transition to clean renewable energy. This one is 26,000 people in 13 countries. It was taken by Ørsted, and there are the countries listed. So it's interesting. 82% of the people, of 26,000 people, that's a pretty good-sized sample, they want 100% renewable energy. Only 66% of the same people believed climate change was an important issue, which is kind of a scary thought. But why? But it's good news that people still want to go to clean renewable energy even if they don't believe in climate change. And so, I mean, if you can get to the solution, then so what if they don't believe in it? So just do a runaround, you know. But part of the reason, well, 69% say renewables make countries more energy independent, so they're really supportive of that. 73% say renewables boost economic growth. And so there are a lot of reasons people like renewable energy, even though they don't necessarily believe in climate change. So anyway, here's another poll that's consistent. This was a poll in the United States only, but it looked at individual states. But the nationwide number is on the top. The question is, do you support or oppose powering all energy in the U.S., so that's 100% of the U.S. energy, entirely by clean and renewable sources like wind and solar and hydroelectricity by 2050? That means homes, businesses, cars, and trucks. So 64% strongly agreed, 19% somewhat supported that contention, and only 16% opposed. So the 64 plus 19, that's 83%, were either strongly or somewhat supportive. That's pretty consistent with the other result, which was 82% wanted 100% clean renewable energy. And you can see there's a variation by state. Even in Iowa, which has the highest fraction of electricity from wind, I mean, of this, that was the lowest total number supporting this, but still pretty large number. So there has been some action towards going to clean renewable energy, at least proposed action. This is no action actually occurring, but there is a House resolution for the U.S. to go to 100% clean renewable energy, H.R. 540. There's a Senate resolution, 632. There's a Senate bill, S. 987. There's a House bill, 3314. They're all sitting there waiting to be voted on, and they all have co-sponsors for the United States to go to 100% clean renewable energy. They're just waiting for somebody to approve this, right? But there's more action going on at the state level while the federal government is sitting there doing nothing. So at the state level, New York has passed a 50% clean renewable energy law for electricity by 2030. California also has a 50% by 2030 law, but there is a bill that's been proposed that's kind of sitting there waiting to be voted on right now for 100% by 2045 and 60% by 2026. Massachusetts has a 100% law that's waiting to be voted on this year for all energy sectors by 2050. And Hawaii has a 100% law existing on the books for electricity by 2045. And also Washington State has a 100% law for electricity that's going to be voted on this year as well. There are, though, over 60 towns and cities that have committed to 100% clean renewable energy. So this is really happening, lots of support at the local level. And some of the bigger ones are like Atlanta, Georgia, and St. Louis, Missouri, and Madison, Wisconsin, and Portland, Oregon. And we even have a bunch in North Carolina, like small towns and cities, Silva and Boone, North Carolina. But now they're over in 12 cities and counties, including like Watauga County. Abita Springs, Louisiana is another one. Moab, Utah, places, small towns and cities, but also big towns and big cities as well. So there's a lot of commitment at the city level. And then there are over 123 companies worldwide that have committed to 100% clean renewable energy. In fact, Google in 2017 was the first company to power 100% of all its operations with clean renewable wind and solar in 2017. So it actually has accomplished that goal, and many of these will accomplish it before 2020. But these are the major companies of the world have all committed to 100% clean renewable energy, and including all the top 5 companies, Apple and Facebook and Walmart, as well as Google, and well, you can see them listed here. But this is a lot of it's driven by nonprofits, including over 70 nonprofits that have committed to this transition and that are helping getting these towns and cities. The Sierra Club is working pretty hard. I helped co-found the Solutions Project along with Mark Ruffalo and a couple other people, and this group is really dedicated to trying to engage diverse communities and try to get the word out, get information out to individuals and to policymakers about what's possible, kind of like what I've been talking about today. But there are all sorts of other groups that have really found that it's better to be for something rather than try to just be against something, although it's still necessary to be against things as well. And then, so just to summarize, we looked in jobs as well, by the way. And in the U.S., we create 2 million net jobs over lost. These are long-term, full-time jobs over lost. Worldwide, around 24 million. As I mentioned about the land requirements, around 1.15% of the world's land to transition. We'd avoid 4 to 7 million air pollution deaths each year. We'd slow, then reverse global warming. We find that we can keep the grid stable with 100% clean renewable energy. We'd keep the cost of energy less, and individuals would pay even much less than that because there are fewer kilowatt hours of energy required in this system. And the social cost is about 1/4 that of per kilowatt hour, is 1/4 that of fossil fuels. Transitioning to 100% clean renewable energy, we think it's technically and economically possible. There are social and political barriers, but the only way we're going to get to a solution is with collective willpower and immediate deployment. We can't wait around for the next great breakthrough miracle technology. If you are interested in more information, well, there's a similar talk, there's a website that I gave a few weeks ago that has these slides plus additional ones, but there are also websites for the actual roadmaps we developed for the states and countries and towns, and the grid integration studies. There are infographic maps at the solutionsproject.org, and also if you want to get information from Twitter, I update things there quite frequently. So thank you very much. I don't know if there's time for questions, but thank you.
I think we have time for a few questions.
Okay. Yes.
So how much of this transition is going to take place because of market forces versus how much do we need policy decisions?
Well, yeah, the nice thing is the costs have come down for wind and solar and batteries and electric cars and a lot of these technologies in the homes. So there will be this natural transition, but it's way too slow. I mean, we need to ramp things up by an order of magnitude. Eventually, just by the economics, I think things will transition, but that could take by 2100, So we need 80% by 2030 and 100% by 2050. And the only way to do that is by strong policy measures worldwide, in addition to individuals making efforts on top of that. You had a question?
So who makes this presentation to legislators, journalists, teachers, science teachers? The Heartland Institute is going the other way. Who gets the word out?
Sorry, are you asking who gets the word out?
Yeah, besides you.
Oh.
How do you magnify it?
Well, yeah, that's a good thing. That's a key thing. Information is one of the limiting factors. How do you get to information to 7 billion people? I mean, I can speak to a few hundred to thousands, even tens of thousands, but we need to get to millions, to hundreds of millions, to billions. And that's where some of these nonprofits have been helpful. The nonprofits have been helpful getting information out. But you're right. It's how do you get it out? That's an important question, and I can't say.
Article that's been done somewhere on this.
Pardon?
What's the best magazine or newspaper article that's been done on this?
Well, I mean, I've done a lot of work. That started in 2009. We were in the cover of Scientific American, and there was a.
For real people.
Yeah, for real. Yeah, that's a good question. I did do an op-ed with Bernie Sanders last year. That was.
Okay, thank you so much. We do have to close right now, so.
Thank you so much to Dr. Jacobson. And we're now going to move on to our next panel. And if Dr. Costello is in the house, I'd love to have him come up. And Ira Dreyfus will introduce Dr. Costello.
Hi, folks. In the interest of time, we're going to have the world's shortest introduction, possibly because I think everybody has already heard of Dr. Costello. But one of the great things about this panel is that we are going to have what amounts to a tour d'horizon of where we stand right now in terms of public health and climate change. Dr. Costello and the Lancet Countdown gives us the global picture, but we are going to drill right down into the suffering of individual cases and individual patients with doctors, with the next two doctors that we will have. My name is Dr. Starfleet pointed out, is Ira Dreyfus. My background is primarily in journalism. 26 years as a reporter at the Associated Press, primarily in health and medicine. Then about 10 years in the U.S. Department of Health and Human Services, again in health and medicine doing public affairs. That's my background. I'm currently a public affairs advisor to the consortium, and it is my great honor now to introduce Dr. Costello.
Thank you very much. Whoops. It's fantastic to be here. I'm feeling inspired. I've just spent a week in Yale on clinical, environmental, sustainability issues. I'm inspired by this meeting, and I think Professor Jacobson's talk is possibly the best talk I've ever heard. And I'm going to get you on. I'm starting to podcast because I retired from WHO 3 weeks ago. And I'm going to be pestering you on Skype to get this out because that was so, so important. What have I done? Sorry, are you an expert on? Not that one. No, don't go.
Last slide, you need to go back to the first slide.
Go to the first slide. Sorry, you're absolutely right. Thank you. That's it. Okay, thank you. Thank you very much. So I'm going to talk about the Lancet Countdown. I went to a conference like this 11 years ago, and somebody put this slide up to show the atmosphere and said we've got a big problem with carbon pollution. And up to then I kind of thought, if you're in Britain, 2 degrees warmer is a good idea. And a few polar bears, And then I suddenly realized, I thought Malthus got it wrong, Paul Ehrlich may have got it wrong, but this is very clever to kill off a rapacious species like humanity, the waste product. And were we going to fix it in time? So that's what worried me a lot. And suddenly I got actually quite depressed about this and thought, what can I do? And then I heard a talk from Chris Rapley, who was director of the British Antarctic Survey. And he said, this is what's going to happen. It's going to affect all the systems. And I thought, well, geologists, meteorologists, biosphere, humanity. We do a bit of that in healthcare. And in fact, at that time, I was working on a lot of community mobilization programs. This is in East India, in Jharkhand state, where it's a very complex system. And I thought, well, maybe some of what our experience as physicians or in this is relevant to the whole climate debate. And maybe there's no such thing as a climate change expert because it's going to affect all of us. So then I got more actively involved. I realized it's about the intersection of these issues. I knew a little bit about population and development. I needed to learn about the environment. And then Richard Horton, the editor of The Lancet, phoned me up because he knew I was a new director of the Institute for Global Health in University College London. He said, I'd like you to do our first commission on climate change. I said, I know nothing about climate change. And I said, go to Andy Haynes or Tony McMichael. And he said, no, I want a university to look at this. So I wandered around the faculty, the campus, talking to economists and environmentalists and scientists and mathematicians and philosophers even, and got a fantastic response. And we set up a group. We had no money, and the first commission was simply our university coming together And we had a good headline. It's the biggest global health threat of the 21st century. So all the media arrived, and that was fantastic. But after 4 years, you know, we'd had a nice publication in the Lancet. But Chris Rapley came to me again and said, we totally failed. The environmentalists have just failed to get any traction on this. Maybe the health angle is more powerful. This time we turned it round on its head and said, look, tackling climate change could be the greatest global health opportunity of the 21st century. And that's more important. That's why I loved your talk, because it shows what's feasible about solutions. We can do this. And it's not about doctors, it's about engineers and economists and politicians. And it's about America, because you are the global leader, you are the global superpower, and we always look to you for leadership and innovation. And I think it's going to come, and it's going to be a grassroots movement. This is an important slide. The bottom is Human Development Index. Moving to the right is good, and the vertical is your ecological footprint, and that big red circle at the top, I'm afraid, is America. You're 10 times what you should be. And, of course, I've been involved in development of mothers' children's health, and, of course, there's been a lot of improvement that direction. But the big challenge is now this. We're the problem for sustainable development. And that's why we've got sustainable development goals. And people talk about health in all policies. Health is number 3. People got fed up with that. But actually all of it is about health. And it's a big challenge. Now, I've got a lot of time for Bill Gates. He funded 85% of my department at WHO, which is not right, actually. Why should a billionaire from Seattle pay 8 times as much as Germany? You know, I'm into multilateralism, but the member states have got to step up. But anyway, Bill Gates edited Time magazine 2 months ago, and he does talk a lot about things are getting better because he wants to get positive messages about. I agree with him on the Human Development Index, but there is a caveat to that, which he understands because he's investing in all kinds of renewable technologies. So we've got to meet the development needs of the present without compromising the future. This is a guy who inspires me. I've never met him. He's an economist from Cambridge, Siddhartha Dasgupta. And he says, look, wealth is actually a series of stocks. It's not GDP. It's a series of stocks, not a flow. So you've got your manufactured capital, human capital, knowledge. All of those have improved over the last 25 years. Institutions, I'm not so sure about in any country. And natural capital is going down. So if wealth is a series of stocks, he says the consumption-environment relationship is not self-correcting unless there's concerted action at many levels. And that's what we're not doing. Or we're doing it, but very, very piecemeal. And we have a vision of what we could do. And it saves money. And it's good for all of us. Now, I learned a load of other things. We know about tipping points. Climate is not linear. Jim Hansen, who was the NASA chief and has done fantastic work on this, shows how climate flips up and down. And the one we know best is permafrost, where melting of the peri-Arctic zone is going to lead to methane. And I've spoken to 2 world experts on this, and they say we don't know what's happening. We actually don't know how much methane's coming up. So we've got to move fast. I also learned about this, that 2 degrees shift in a mean doesn't sound much, but it's the extremes that you're worried about. That's what pushes up a lot. Or even if you don't shift the mean, but you shift the variance, you get more, say, record hot weather. And if you get both, you can get a hell of a lot more. So it's the extremes we're worried about. We've got to communicate that. And that's already happening. Now, in WHO, where I learnt actually about the impact of the environment, I think this is an underestimate, but they say just over a quarter of all childhood deaths are linked to the environment. And that figure that someone put up, about 250,000 deaths, I think that's a grotesque underestimate, actually. They were extremely cautious in the way they projected those figures. And this is a picture from 3 weeks ago, the last white northern rhino. And I know many species are affected, and it's not just about the big, lovable ones, but this is a tragic slide. And that keeper playing paying homage to this last of his species. So we face a wicked problem, one that's difficult or impossible to solve because of contradictory changing requirements, interdependencies, what people call a wicked problem. Except it's worse, it's super wicked. As Professor Jacobson said, time is running out. We don't have till the end of the century. There's no central authority. We don't have an effective global governance system. Those seeking to solve the problem are causing it. And we discount the future irrationally. Too many people think this isn't really going to happen. And it's going to happen. And that's why the only thing I've actually done in this whole process, I listened to all these scientists and epidemiologists. But I did say to them after the last report, we've got to set up a countdown. We did this with child survival in 2003, after the series then. And what a countdown does is it galvanizes everyone else. So that for child survival, it was WHO, UNICEF, the NGOs, governments. And it speeded up the effects of moving towards the Millennium Development Goals. So we said, let's do this. And Richard Horton said, yeah, okay. And I said, maybe a report every 3 years, unlike the IPCC. And he said, no, let's do it every year, because it will galvanize attention. So I'm going to just talk through a very few quick findings from some of the latest countdown report. This is now, I hasten to add, a 28 center partnership from all over the world, big presence from China, all over Europe. I think Yale are going to join us. We've already had other members from across the USA, John Balbus and others. So we've got 5 working groups. The first is on climate change impacts, exposures and vulnerabilities. And we said to each of them, come up with about 8 indicators that we can get data on that are relevant and that will give us an indicator of how we're progressing. And we're still working on this, and I think we still need to work on targets so that we can look at the rate at which we're moving on these, if we can, on a year-by-year basis. So, for example, I'll just throw this in because this is just to keep us on our toes. This is a paper from Nature 3 months ago showing that if we continue with business as usual, which is what's happened up to now, then we will be going to 4 degrees by the end of the century with a 93% probability. Now that to me is totally unacceptable because we know that 4 degrees on all of these indicators, food, water, ecosystems, extreme weather, etc., is a catastrophe. So I think we face an existential threat. And it really upsets me that the media talks a lot about Brexit and Facebook and President Trump and the Congress. And yet these things are happening around us already, every week, every day, and we're only at 0.9 degrees. So let's look at health effects of temperature change. The first thing that I found interesting from this group was that if you look at temperature rise and exposure over the last 16 years, where people live is way higher than the global figure. We want to look at the effects of temperature and heat waves on where people live. And we've gone up nearly a degree in like 15 years. And the same effects on the indicators on heat waves. Now, heat is bad news for industry, for construction, for agriculture, where most people work outdoors. And it also has an effect on migration. There's an interesting paper from rural Pakistan showing that floods don't make people leave, but heat waves do. It's by Muller et al. I thought he had other business, Robert Muller, but anyway. And certainly, in the last 16 years, our finding was that exposure to temperature change has decreased physical labor capacity around the world by 5.3%. That's big. And if it's going up, and if we're heading towards 2-3 degrees, what will the impact be on agricultural work? And particularly in the poorest areas of the world. And the economic impacts of that are going to be huge. Now, there is we've estimated a nearly 50% rise over the last 15 years in weather-related disasters. Again, at less than 1 degree of warming. They're not lethal because we have got better resources. You know, I know Bangladesh well. They had a cyclone 30 years ago which killed 300,000 people, and the same strength cyclone just about 5 years ago killed 3,000. So the resilience is great, but there is a limit to the adaptive capacity that you can manage. And if things are getting red, you know, what's going to happen in the Caribbean when we're getting these hurricanes coming in every year? Are they going to be able to recover? Puerto Rico is still in a state of disaster. So we've got to move, and we're going to get a lot more migration as a result. Now, we're all physicians. We're interested in climate-sensitive diseases, and it's a very mixed bag. I mean, malaria, we're seeing much less of, and diarrheal disease. We did a bit of work on looking at the vectorial capacity of transmission of dengue, and you can see that that's gone up by about 10%. So if you look at Latin America, down in Brazil, until 1970, they had none of these diseases. Now you've got dengue, chikungunya, Zika, and they've had yellow fever back, all the flaviviruses transmitted. And I believe you've got albopictus in this part of the world, so you are vulnerable. And within 2 weeks of me arriving at WHO, Zika broke. And I said, what's Zika? And 2 weeks later, I was the world expert on CNN. You know? I mean, fortunately, my university education prepared me very well for being able to talk extremely knowledgeably about things I knew very little about. But anyway, this is Zika. This is Vanessa Van Der Linden, a wonderful pediatric neurologist in Recife, who, with her mother, would see one case of microcephaly a month, and she saw 8 in a day. And she said, there's something wrong here. And she rang around, thought about it, and spoke to a friend of hers who said there's this Zika virus, and she put 2 and 2 together. And it's overwhelmed them, and this hasn't gone away. And I think it's a much bigger problem than people realize. And of course, the costs of a severely handicapped child are enormous to the economy, apart from the emotional and traumatic cost to families. This is massive in my view. This is the thing that's always worried me about food security. The blue line is actually South Asia, and it's on the even bigger scale. But people living in vulnerable situations are actually going up, and food security is hovering on the edge, and the Arab Spring was linked to food riots. And we have to look at this very carefully, and it's not, again, we could see a tipping point. And I think there's lots that we can do around sustainable conservation, which is also linked to better harvesting of water, sustainable sanitation. That's, if you like, the social side of what Professor Jacobson was talking about, the technical side. Okay, on adaptation, I'll be very quick on this. Basically, things are moving very slowly, but there are encouraging signs. Cities are incredibly important. I loved your slide about American cities, because they hold the power. I heard Bill Clinton speak once and said, it doesn't matter what they say in the White House. Actually, even Republican mayors understand about insurance premiums. And so that's very, very important. They are on the move, and cities have much more power than they used to, but there's a long way to go. In the surveys we've done with the World Health Organization on impact, vulnerability, and adaptation, it's very, very sketchy. And even where it's being done, those assessments have not necessarily translated into action. This is my most depressing slide. We have hospitals across the world that don't have continuous energy supplies, that have failing refrigerators, and yet they're all in areas where you've got fantastic potential for solar power, hydropower, all the things we've heard about. And the investment, the aid investment's not going there. You did an amazing thing. Actually, George Bush did it with PEPFAR and invested $15 billion. I think if we did the same into hospitals and healthcare centres, and also set an example to local communities to go solar, WWS, that would be very important. And I was glad to see that the World Bank have just brought out a big thing about climate smart healthcare, and I hope a lot more investment will go in there. On mitigation, this is really, really important, and I'm going to skip over this quickly. Look, the carbon intensity of the energy system, which is the dotted blue line, has basically not changed since 1990. So we've got a long way to go, and that's why I found that talk so inspiring, because we can do this, and it makes economic sense, it will stimulate new industries, it will create jobs, and in the long run, we'll all be better off and we'll breathe clean air and be healthier. Everything you want to do for climate change is good for your health. My colleagues are very optimistic because they say, look, investment in coal has peaked, it's on the downward slope, and I hope they're right. But I read in the Financial Times recently that actually banks are increasing their investments in coal again. So we have to be careful, and that's why I'm glad we're doing this on an annual basis to keep an eye on things. What was that about? I've lost it. Renewable electricity. Oh yeah, this is the good thing. It is going up. It's going up exponentially. I seem to have lost that slide. But we've also got to remember that everyone needs energy, and an awful lot of the world don't have access to clean energy. And household fuels are kerosene, their biomass, or their fossil fuel. And that leads to unbelievable levels of air pollution. 87% of the world's cities do not satisfy safe air. I was in Delhi in November. 2 days and I got asthma. And I don't think anybody would be there. I was on a TV thing and we were giving all the stats. And then a pediatric pulmonologist was the most powerful. And he just said, I've been looking at children's lungs with whatever scopes they use. I've forgotten to look down. And he said, until 10 years ago, children's lungs were pink. Now they're black.
Oh my God.
And that was, yeah, but it's very powerful. And it brings home, and there is huge pressure on them to move, but they've got to move much faster. And they have an opportunity. The Chinese have got it. They're really investing in renewables because they see it as the, as an economic revolution. Where are we? Sustainable travel and infrastructure. Look, we're not doing great. I cycled in Switzerland. I bought an electric bike because I had 15 kilometers to go. Fantastic. Protected lanes. You've got to hand it to the Swiss. I hardly hit a road at all. Absolutely brilliant. I could do electric cycling till I'm, 90. And you could do it. You've got big roads. You can protect cycle lanes. Surely you can do more about infrastructure. I know America was built around cars, but I think we can make that transition, and with electric cars as well. You also like meat. I don't know if I should show this slide, but
That's lunch, guys.
Actually, that's... You are big meat consumers, and if you look at Southeast Asia, when I moved to Nepal, and I was 2 days' walk from a road, and I had to start eating dal bhat twice a day. That's rice and lentils. And I thought, I can't do this. And after a month, I thought this was the best diet ever, and it's still my favorite food, and it's the healthiest diet in the world. Rural Asian food is absolutely fantastic, and it makes you feel healthy. So there is an opportunity to move towards sustainable health. Look up the EAT Forum in Norway, run by a billionaire's wife, Dr. Gunhild Stordalen, who's done fantastic stuff around trying to move towards sustainable food systems that are also really chic and hip and great. Sorry, I can't. Yeah. Finally, investment in coal capacity. Yes, there's been a downward turn, but I think it may go up again before we've got to put pressure on that. Coal is the filthiest fuel. We don't need it. We've got to keep it in the ground. Divestment is a very sensitive subject. We've had big protests at my university, UCL, which claims to be a radical university which won't divest. Look, the student movement, I remember in '68, a lot of you will remember that, kind of took on the world. We then, '79, had the whole onset of neoliberalism, whatever you think of that, George Mason. Take back control is now a much more contemporary issue on both the right and the left. And students are on the march. And students are taking the lead, actually, on things like gun control, but also on divestment. Yale University has not divested its $28 billion endowment from fossil fuels. Academics need to take a lead, in my view, and I think civil disobedience or protesting against investment decisions is a key part of the political component that will lead to Professor Jacobson's wonderful future. Carbon pricing is not happening. 13% of all emissions are covered by low carbon markets. Why have they not taken off? Well, this encouraged me. So James Baker and George Shultz were eminent Republicans from the conservative wing. And last year they came up with a carbon tax proposal, which by all accounts will achieve your Paris commitments. I think often you need to, I'm not from that political wing, but if that is the case and they're arguing for it, then we should all get behind it. It's maybe not perfect, but let's get a start on this, because economically we need the incentives to move away from fossil fuels. And I know you're going to talk about that later. Finally, positive feedback to corporates. There's a thing called the Carbon Disclosure Project. If you look at all your investment portfolios, there is a CDP rating for many companies. This is the UK, for example. So Tesco, the retail store, gets an A, whereas British Aerospace Systems gets an E. So it's not very. It also makes bombs to sell to the Saudi Arabian government to drop on Yemen. So British Aerospace Systems is not the most healthy. Sorry, that's my 25 minutes. So, finally, media coverage, not enough. We've got to do everything we can to get the kind of message that we heard in the last talk out, because it's so positive. And finally, can I just finish on this? I've spent the last 20 years doing cluster randomized controlled trials, working with women's groups in Nepal, India, Malawi, Bangladesh, showing that getting together in this so-called thing, a sympathy group, is incredibly powerful. Even where your health services are rudimentary, we slash neonatal mortality rates. You've got to get the dose right. There needs to be a science of this. And I've just written a book about how I think sympathy groups might tackle 21st century problems, including all the interventions around climate change. And there's a great deal of stuff I've been reading about the history of America, and when de Tocqueville came in the 19th century and observed how the American dream was built actually not by individuals. It was built by small groups in civic, responsible mode, building things, developing things, and the amazing, future that America became. Finally, can we change the system? This is my brother. He is an American. He left London when he was 22. He had no qualifications. He came here, joined an ad agency, and he ended up as corporate marketing chief at General Electric, working with a guy called Jack Welch, who you've probably heard of. And I hadn't seen him for 2 years, and he picked me up last week in Darien Station. I said, "Hi, Richard." He said, "Hi, I've got my SUV. We have 4 SUVs for the family." And he said, "What are you doing here?" I said, "I'm going to Yale to talk about climate change." I said, "What do you think of climate change, Richard?" He said, "It's not going to affect me, and all you bleeding heart liberals are not going to change the system." And I thought, this is a good welcome to the United States. This sets the bar about whether or not we can make a change. And that's the people we've got to... Fortunately, his wife, who's a Democrat, and my brother did actually vote for Hillary, didn't vote for Donald Trump, but he is a Republican. But you have to talk across lines. We've got to talk to one another. We've got to stop all this fighting and all the rest of it. I've stopped doing all tweets against Brexit and Trump. We've got to somehow find solutions, because this is much bigger for our children than anything about party politics right now. And so it's nice to be at George Mason. And just to leave, the book is called The Social Edge, The Science of Sympathy Groups for Our Health, Wealth and a Sustainable Future. I hope it will be out in the summer. Thank you very much for listening.
Okay, I'm next. I'm Dr. Jewel Crawford. I'm with Morehouse School of Medicine and also co-chair the Commission on Environmental Health with National Medical Association, which we founded around 1999. So I want to thank Mona and Mark Mitchell and everybody that worked on this conference. Just great having you all here, and also Professor Jacobson for that excellent talk. I thank him so much. So I want to talk today about the link between environmental justice and climate change, because they are inextricably linked. The same pollutants and toxins toxins and processes that are causing climate change, are causing the problems with environmental justice and polluting communities. And we got to get away from showing climate change with the polar bear on the melting iceberg, surrounded by water, because that's alienating for people. It's far away. It's not, there are no polar bears in their neighborhood, and people don't make the link. They're not, that 66%, that who the mathematicians, what's the 34% of the people that don't believe in climate change? I mean, because they're seeing polar bears and owls, they're not making the connection. So we've got to bring it home. And clearly, people of color and poor people are more impacted by climate change and environmental justice issues than maybe wealthier people, but it's impacting everybody. We've seen that in California. We've seen that in Santa Barbara with the houses burning down, the $1 million homes that are burning in the fires, and also Hurricane Sandy, Florida. Everybody's impacted. However, we know that communities of color, and particularly fence-line communities, where I used to do a lot of work and did site visits in what we call Cancer Alley, along the Mississippi River corridor, where all these oil refineries and plastic plants, or you can drive for miles and there's just refinery after refinery, and people are living there in these fence-line communities. And there was a study done in 1987, then revisited 20 years later by United Church of Christ and Dr. Robert Bullard, who's called the father of environmental justice, that showed that African Americans and people of color and poor people are more highly impacted by climate change and environment. So when the floods come, and you have the last one in Harvey and Maria in Puerto Rico, in these fence-line communities, it's not just water. They are awash, and these waters are contaminated with carcinogens, with volatile organic compounds and benzene and things like that, which we know causes leukemia in children. Okay, and so if you're working in these communities and seeing these patients, it behooves you to know the contaminants in your area, and we've all got contaminants in all of our areas now, and they can be found online, which ones are impacting your community. But know, if you're doing primary care, if you're a practicing physician, know which organ systems are impacted. Why do you want to know that? Well, if it's a child and you know they've been exposed to benzenes and VOCs and whatnot, then you want to check that CBC more regularly than every visit maybe, and see if you're starting to see a change. So we can intervene early. So we're not waiting for our patients to come in with metastasis from head to toe before we realize. We know poor people delay treatment because of health insurance issues, and I won't go into the whole single pay and Medicare for all, HR 676. Well, that's another discussion. But we know that people delay care, and so we want to really be checking the organs that are most impacted. If they work in a factory around plastics, we know vinyl chloride, then you need to do liver function tests. You need to do those tests and be looking for changes early on. So if a malignancy does develop, or whatever other problems, renal failure or whatever, renal failure from the coal ash. The coal ash, there's tons of it. So when these floods come and people are exposed to it and the water is contaminated, then you have these heavy metals that patients are exposed to, and heavy metals damage the kidneys and cause renal failure. So you want to be checking those renal function tests and see and monitor, as people go along. So again, we can intervene early when problems arise. Puerto Rico, Virgin Islands, they're drinking water from the Superfund sites that's contaminated with the Superfunds. Sometimes there's so many chemicals around, and we have such poor policies, we don't even know all the health effects of all the chemicals. But a lot of them are carcinogenic. And so if in Puerto Rico, if you do any work down there, and we know people have been around Superfund sites and so forth, then, we have to monitor our patients really closely. So along with all the other health effects that have been discussed, the mental health, you got the mold problem, we go on and on. We as healthcare providers have to do more CME, more continuing medical education, so we can know more about these health effects and know how we can help our patients better. That's one thing that has to happen. The other thing is that We need to have a national strategic plan to address climate change and environmental pollution. And maybe that's one of the things, with all the expertise that we have in this room, and, you know, the reaching out, and Mona, you know, all the work you and Mark and the others have done, you know, maybe that's something that we can work on. Just like we have a history in physical that will, I mean, people can come in with any kind of problems, and for the physicians in the room, remember patients we call the train wrecks, you know, they had so many problems, you run out of room on the form, you know, writing them all down. But still, we do an H&P for each and every patient, and we tailor it and custom it to the particular patient. So we need a national strategic plan for to address climate change, and that's something that we can do. And, you know, right now we can forget about the federal government, but we don't really have a functioning federal government at this point. But the cities and people are doing things on the local level, and that's really what counts and what it comes down to, even down to the neighborhood. You know, I spent some time in Cuba and touring that system, and, you know, they have the Committee for the Defense of the Revolution, and for every block, there's like I don't know, people from New York, we had like block captains, you know, with your neighborhood associations, but there was somebody that knew everybody that was in every few houses there. So when the hurricanes come and the storm comes, somebody is knocking on the door, they know that there's an elderly person there, we got to get a wheelchair here, you know, there's a pregnant woman, and, you know, they're pulling the people together and going house to house, and they get everybody out. And, you know, they have very low casualties compared to all the other places, you know, where you have all these hundreds of people that are dying in these Category 5 storms. You know, their morbidity is really, mortality rather, is really minimal compared to other places. And it doesn't take money. It takes caring, and it takes organization. It takes some money. But, I mean, we're not talking about millions of dollars to go and check on your neighbors. You know, and we have to do that more than we're doing it now, and it's actually extremely effective. You know, I mean, my house, they'd have a hard time. I have 4 generations. My mother's there. My daughter and her family moved there with a 1-year-old, so I have them from 1 to 98. So they'd have a long list trying to come to my house. Oh my gosh, she needs a wheelchair, she needs a stroller, she needs this, she needs that. But that's what needs to happen, you know, in terms of what, you know, because another hurricane season is what? 90 days out? So, and people haven't recovered from the last one. So the other thing is the policy issues. You know, we need improved chemical safety, and of course, no need to go in any more about wind and solar and renewables. And the other thing that we can do is our own individual actions. You know, our buying habits. You know, consumer choices are very influential with policy. How we spend our money. I saw one thing. It said, "Is it just that simple? Buy here, not there?" Well, probably not, but that does help. And, you know, stop drinking bottled water. It just drives me crazy, the plastic bottled water. You know, there's just billions of them. It takes so much petroleum to make this water. I mean, it's very simple, but I mean, you know, it's ruining, you know, the planet, these bottled waters. And then you know, take your own bags to the store. You know, you can just put your stuff in the cart. If you forget the bags, which everybody forgets their bags, just leave it in the cart and take it to the store, take it to your car and bag it up at your car. You know, there's other things that we can do that make a difference. And so, you know, support sustainable agriculture. I mean, check on your own institutions. What's being done there? I mean, even here, I cringe because I throw my plastic cup away, and I said, "Where's the recycle bin?" You know, so all of those things, all the little things, really count that we do. They all add up a little bit at a time, and maybe we can't all get our houses like Professor Jacobson's, but we can do as much as we can to help on the individual level in that direction. So thank you very much.
Yeah.
Okay, I'll try to be brief. Hi, my name is Dr. Caban Aleman. I'm coming from Florida International University, Miami, Florida. I am also a Puerto Rican psychiatrist working from the diaspora there, much more after the Hurricane Maria. I'm representing the American Psychiatric Association, and I'm also a community psychiatrist with the American Association of Community Psychiatrists. I just wanted to focus on a couple of points that have to do with mental health that were discussed. Dr. Costello said that we can do this, but I think that it's much harder for the real people that we've been working on to do this without much resources and without much support. So I think that the focusing our efforts on developing our research and our work on the social determinants of health would be something that would be fundamental to make that happen for big communities and the people that are actually feeling the impact of climate change already, and that will feel it before most of us here in this room. So that aspect is very important. I think that this is really a social justice issue, and we need to focus on efforts also on equality. I wanted to just mention a couple of solutions I thought of that I've seen in Puerto Rico and Florida. What I am doing in Puerto Rico is working on community engagement and community resilience projects. It's actually very similar to the work of community participatory research, for those of you that know it. And what we're doing is partnering with different grassroots organizations that are working with the most isolated portions of the island, very commonly in rural mountain areas of Puerto Rico. And we're partnering up with local leaders that really know the communities and know where the help is needed to go over there and bring them some support. We're focusing on training community leaders on transformational resilience, mindfulness, and psychological first aid to really empower them to deal with their own trauma, process everything that they've gone through, and have more strength to keep going. Like most of you probably know, we're still almost 7 months after the hurricane. I think the number for today was 150K people in the island don't have any power, and still there's a lot of people that haven't had running water since. I think the Secretary mentioned the crisis with 10 days without power in Virginia. Well, these people, most of them don't only have chronic respiratory problems and diabetes and hypertension, but they also have very high rates of depression, PTSD, and multiple other conditions that are related directly to climate change. The situation with the 20 free Superfund sites and all of the coal ash burning facilities in the island has been investigated, but very poorly. What we're getting is third or fourth hand support with a little bit of people here and there coming from federal organizations that are doing some research. But thankfully, the organizations that are NGOs have been very supportive and are helping us get the word out. So solutions that I wanted to mention is also through that empowerment in the community, there's a lot of grassroots organizations that are coming up with ways to fight food insecurity, to become more sustainable. The last time that I was in Puerto Rico was a couple weeks ago, and we worked with an organization that's working on ecological projects, bringing the opportunity to certain communities that are very isolated without power still, an opportunity to grow their own crops, to learn how to do agriculture. Puerto Rico was an island that had a lot of agriculture until the 50s or 40s, but that was replaced by industries. So now there's a movement of a lot of people that are very young in universities wanting to go back to plant and grow their food and become more self-sustainable. So those are very exciting things that we should work on and we should support. If we only stick to, in my field, would be therapy and medications, we're really not going to get them empowered and help them become resilient. It's just not enough. And telling people, get strong, practice some breathing exercises, and toughen it up. It's not very helpful when you've gone on through multiple months without resources and when the government is not really there to help them. So we really have to work around all of these other options to empower them and gone beyond the typical models of health that we usually practice in this country. I'm going to leave it there.
We don't have very much time for questions. I'm going to sneak in the possibility of asking two anyway. So if anybody out there has a question, this is your one chance to do it. Otherwise, we're going to be missing our coffee break. Everybody likes coffee. Okay.
All right. Well, thank you to our speakers. And now we have time for a 15-minute coffee break. So please get yourself something to revive and come right back.